So if you're feeling overstressed, overwhelmed, anxious, discouraged, depressed, let me give you a little bit of a formula that will help you work through this. And here's the formula. Thoughts plus feelings equal actions. Thoughts plus feelings equal actions. How you think and feel pretty much dictate what you do. Now I want you to look at that like a mathematical equation, like 1 plus 1 equals 2. If you change any of the integers in the equation, then the formula changes. The end result changes. So let's take a look at what we can change there. Let's start with feelings. Now in your handouts, you have a list of feeling words. And I did that because sometimes it's very difficult to put a word around what we're feeling. How much control do you really have over your feelings? Actually, none. They kind of are what they are. Your feelings are what they are, and you really don't have any control over them, but there are two things you can do with them. And the first one is to accurately identify them. Because many times what we think we're feeling is not actually what we're feeling. We may think we're angry. I'm just really angry about that. But when we get to the core of what's going on inside of us, it may be that we're just very sad, or we're afraid, or we're overwhelmed. And anger is just how it comes out. So you want to accurately identify your feeling as best you can. And that's why I gave you that list of words, to try to wrap some words around it to get to the core of what the genuine feeling is. The second thing you can do with your feelings is to seek their root. So once you've identified what the feelings really are, where is that coming from is the question you want to answer. Where is that feeling coming from? Well, this is how I felt when my older sister used to tease me and call me fat. Or, whatever the root of that feeling is. This is how ashamed I felt when my parents used to call me lazy and stupid. Now, I'm not saying to blame everything on your family, but I'm saying that many times the feeling that is triggered in the present actually comes from some previous thing. So you want to take a look at what the root of the feeling is. Now let's talk about your thoughts. Now your thoughts, you have some control over. You have some control over your thoughts. You can challenge them. When you are stressed, when you are overwhelmed, when you are anxious, when you are depressed, when you are discouraged, your thoughts are not accurate. In the best mental health seasons of your life, your thoughts lie. When you're struggling, your thoughts really lie. And your thoughts are powerful. And frankly, you don't have to believe every thought that you have. Your thoughts are really, really powerful. I mean, you can have instant physiological changes based on a thought that goes through your head. Because every time you have a thought, and your brain is a never-resting thought machine, every time you have a thought, your brain releases chemicals. So think of what happens when you see a bee hovering around your head. Instantly, your fight or flight mechanism goes into place. And your reflexes jump into action, and you're shushing that bee away, and you start to breathe fast, and your heart starts beating a little bit faster. I'll give you a real-life confessional example of how your thoughts can be powerful and how they can instantly physiologically affect you. I have some bulging discs in my lower back, and so the doctor sent me to have an MRI of my lower back, and I went in one of those, I don't know if you've ever seen one of those little MRI tubes. They're almost coffin-like. They have an open end on both sides, on both ends, but boy, they get you in there, and it's very, very cramped and close quarters. And so before I go in there, I'd never had one before, the technician is telling me, if you get in trouble, just squeeze the little bulb that you're going to have there, and I'll be able to hear you all the time, so you can just talk to me and tell me, hey, get me out of here, and I'll get you right out of there. And I am thinking arrogantly, do you know who you're talking to? I mean, I'm Dr. Mike Marino. I'm the guy that teaches people how to control their emotions. So the guy gets me into the tube, and I mean within 10 seconds, I am freaking out. I'm having a total panic attack. My heart is pounding through my chest. I'm breathing, about to pass out. I'm breathing so fast. And I'm thinking thoughts like, I never want to be buried. I never want to be buried. Just cremate me, sprinkle my ashes over the lagoon at Disneyland. I totally was freaking out. And I had to start talking to my thoughts. So you can challenge your thoughts. Because 100% of my physiological reaction, which was very powerful, was generated by this inaccurate thought that I was suffocating. in that too. It was just an inaccurate thought, and I had to remind myself of some very obvious things. There was an open space above my head, about 6 inches above my head, where plenty of air was coming in. The fact that millions of people have come in and out of these MRI tubes successfully. The fact that there was an experienced technician right there who does this all day long and was there to walk me through every step of this, and that I was going to be fine. And that in fact the worst thing that could have happened, because I was hyperventilating, is that I would pass out, lose consciousness, at which time my breathing would return to normal. I would regain consciousness and come out of the tube and complete the test. So as I began to challenge my thoughts, of course my heart rate went down, my breathing returned to normal, and I was able to complete the test. You can talk back and challenge, you can talk back to and challenge your thoughts, but your thoughts are powerful. Your thoughts are powerful, and your thoughts lie. And you will have during this season of your life some very inaccurate thoughts. So you have to challenge them internally, and sometimes if you have a safe, sane community of support, bring them out for others in your circle of support so that they may be able to filter them for accuracy. You know, you cannot positive think your way out of being overstressed, overwhelmed, discouraged, and depressed. You cannot positive think your way out of that, but you can accurate think your way out of that. And accurate thinking is the goal. So we talked about feelings and we talked about thoughts, but let's talk now about actions, because actions are the things in this, is the thing in this formula over which you have the most control. There are things that you can do from a biological, psychological, social, and spiritual perspective to change your thoughts and feelings. There are things from a biological perspective. For example, you can begin a structured exercise program. You can take a look at what you're eating. You can get your hormone levels checked. There's just any number of things on the biological front that you can do to help better manage your anxiety and depression. Psychological, we talked about your thought patterns. You can learn how to challenge your thoughts. It's called cognitive behavioral therapy. I mean, you can learn how to challenge your thoughts. It's not as hard as you might think. It just takes a little bit of practice, and we're going to do some of that today. From a social perspective, you know, what does your circle of support look like? What does your family look like? How about your family of origin? Do you have safe, sane people in your life? Do you have safe voices speaking truth into your ear? Or do you have a lot of toxic people in your life that really aren't helping you in your struggle with being overstressed and overwhelmed? And then from a spiritual perspective, you know, I am not going to preach to you, and I'm not going to tell you what to believe, but I am going to challenge you to examine what you do believe and why you believe it. Those are two key questions to answer as you move forward. What do I believe, and why do I believe it? Because actually, that affects how you respond to almost every area of your life.